Everybody, welcome back to Heart Health with Michelle. Today we're going to talk about homocysteine briefly. For those of you who don't know me, welcome. My name is Michelle Rothenstein. I'm a registered dietitian nutritionist who specializes in heart disease prevention and management through science-based nutrition, really looking at the whole picture of your heart health to reduce your risk of heart disease and heart-related complications, no matter where you are in your heart health journey. I want to talk about homocysteine because it's often not a topic or a lab parameter that many people test for, and it's important that you advocate for it to be tested to ensure that we are addressing it if it is high. We'll talk today about what it is and why it's important to address it. But I just want to emphasize the importance of taking a metric driven approach to your heart health. There are so many different risk factors for heart disease, from insulin resistance to atherogenic LDL cholesterol to inflammation to blood sugar levels to uric acid elevations. There's so many things that can increase your risk of heart disease. And when you apply a heart healthy diet, you really are looking at optimizing all of these metrics because they all matter. And anyone who says that only one of them is important is really not looking at the whole picture of your heart health. So take that in mind and let's do this together today. Let me share my screen. Here we go. So I want to look at this review from Ranjbari et al. In terms of looking at homocysteine and how it affects heart health. So for one thing, homocysteine can cause vascular damage that can make more of these fatty substances to enter into the arterial wall, causing damage and increasing the risk of atherosclerosis. It also may increase blood clotting risk factors as well, and we want to make sure, and it also can increase oxidative stress, which is an important component to the heart disease picture. We want to optimize our vascular health. We want to protect our blood vessel lining. We want to prevent the promotion of plaque formation in the arteries. And so we have to be looking at homocysteine. Homocysteine can be elevated for a number of reasons. It can be elevated due to a deficiency in B vitamins like folate, B12, and B6. It can be due to genetic factors like the MTHFR gene that doesn't allow the body to methylate your B vitamins effectively. It can also be elevated from thyroid issues, from kidney issues, from psoriasis, from uncontrolled inflammation. So we want to look at all of these factors to help create a model to help lower your homocysteine levels. So you can request your homocysteine by a lab, and your goal is to get it below 10 umoles per liter. And we do that by seeing what's the cause, what's the reason for why your homocysteine may be elevated. It may be having to do with all of these factors, one of these factors, but once we really target the approach to understand why it's elevated, we can then help to lower it. So check your homocysteine levels. It's an important piece of the picture for heart health. Make sure you're looking at all of your lab results too. I created a blog post. I wrote a blog post all about cardiac panel metrics that you should know about for your heart health, and you should optimize them through science-based nutrition. If I can help support you in any way, feel free to reach out to me. You can check out my website, entirelynourished.com, where I have group programs, I have one-on-one programs, and I just have a lot of complimentary information about how to take action in optimizing your heart health. 80 to 90% of heart disease is preventable, and we can take action. The earlier we do, the better, but it's never too early and it's never too late to take action to protect your heart health. Hope this was helpful, and we'll talk again real soon.